Community groups in Singapore are scrambling to help foreign workers during the COVID-19 pandemic. A focus are those living outside the dormitories who may find it harder to get food and medical assistance. More and more foreign workers are facing strict isolation measures due to a surge in cases among their community. Deborah Wong with more.
Food, healthcare and internet data have been catered for. But even so, one employer which has about 200 workers in purpose-built dormitories says there's a need to keep an eye on their mental health, now that more are being confined to their dorms. Over 20 dorms linked to clusters have been gazetted as isolation areas.
They are going to be very bored, no matter how much internet we give them. So some of the things that we've recommended to them, It's Raining Raincoats has come up with free online English lessons. We push that to them. They have online music and art therapy lessons that can be conducted remotely. It will be very, very helpful.
Mr. Lim says the firm checks in on the handful of its workers who don't live in dorms, but who can't go out due to the circuit breaker, or because of stay-home notices issued to all work permit holders in the sector. But there are concerns this group may fly under the radar if some employers can't step up.
Access to fundamental needs like food is a huge logistical exercise which some employers may not be even prepared for. Some of the workers we have been talking to do not feel confident. They're still anxious about whether they'll get paid.
Home received over 50 calls for assistance daily in general in the past week, and it's trying to deliver supplies to those who need it first. But coordination is key at this critical juncture. Ground-up movements are making sure nobody falls through the cracks.
They do not know that they're on stay-home notice is the first one. Secondly, they do not know who to reach out to in terms of help, in understanding different advisories, because advisories are being updated on a daily basis. So synthesizing those advisories by working through MOM, saying this is how you can attempt for recourse on, say, wages or in terms of accommodation and food.
The surge in COVID-19 cases has pushed a once invisible issue to the forefront.
Discriminatory attitudes are very deeply entrenched in our society. Singaporeans can either choose to remain in the background or start a movement, change public discourse.
One group says the relocation of migrant workers in essential services to the heartlands, for instance, has sparked anxiety among some residents. It hopes to change this by starting conversations in the community.
We hope to address some of the concerns which I also mentioned earlier from the local residents, and we will have migrant worker groups, supporters, as well as also doctors, because there are clearly health concerns. In the long term, how do we then reframe our relationship with our low-wage migrant workers?
Ms. Ong says she will be raising this issue in Parliament.